Still in Borno State, about 237 school children in Mafa local council of the state have been trained in various entrepreneurial skills and empowered with startup kits. This move, according to the donor group, is to make the children self-sufficient to retain themselves in school. Senior reporter Jesse Tafida has more.
A recent report by the United Nations Children's Fund indicates that about 2.8 million children are out of school in the northeast region due to the 13-year Boko Haram insurgency. As peace returns to most parts of the state, government and development partners are putting measures in place to improve the education sector. Yet, the number of out-of-school children remains high, and some parents have attributed this to poverty. Today, Gold Prime is empowering these 237 children with startup kits. They have been trained in various entrepreneurship skills.
We integrated vocational skills training into the package. And you know, when you integrate vocational skills training, it's not about the training alone. They also need to be empowered with startup kits so that they are able to also make a living out of it. These adolescent boys and girls, while they also continue to access education, by evenings can go about these livelihood skills, make monies out of it. With it, they are able to finance themselves through school, also contribute to the livelihood of the household, and ensure that their younger ones also have a decent and dignified living.
17-year-old Yagane Muhammad is happy to be part of this initiative funded by Education Cannot Wait multi-year resilience program, Northeast Nigeria, guaranteed by NLC.
As part of our monitoring plan, we have ensured that we also ensure close participation with the stakeholders within this community, also with the parents and the caregivers of these learners and beneficiaries. We are also going to ensure that our MIL team, which is the monitoring, evaluation, accountability and learning aspect or department of our organization, take into cognizance the post-distribution monitoring and carefully analyze the feedback we have gotten.
As the children get their new kits, they're expected to utilize them. The state government, on its part, lauds Gold Prime for the program and is optimistic that this will ensure continuity in learning and motivate the school children to chase their dreams. Jesse Tafida, TVC News, Alpha.
Executive Director, National Primary Healthcare Development Agency, Muyi Aino. Mr. Aino, thank you for joining us on the news tonight. I was asking you earlier about how much of a game changer this would be for a country known to carry perhaps the highest malaria burden in the world.
To be here, and I apologize for the initial tech connectivity glitches. So this week was very pivotal in Nigeria's fight against malaria. I think due to the leadership of the President and the Coordinating Minister for Health and Social Welfare, Nigeria is one of the very first countries to get access to the malaria R21 vaccine. There is a suite of interventions that we use to fight malaria, and you are right. Nigeria has a very high burden of malaria. There are parts of the country that are even worse than others. So we got our first consignment of 846,000 doses this week, and it will be in addition to existing interventions like use of insecticide-treated nets, but also seasonal chemoprophylaxis, which is periodic treatment, preventive treatment of vulnerable people. You know, in addition to those, this vaccine really became changing because when you combine it strategically with some of these interventions, you get upwards of 90% protection.
Well, we now know that Kebbi and I think Bayelsa will be the first to get the vaccines. But in terms of storage and distribution, do we have the capacity, and what's your agency doing to ensure that these vaccines remain at the required temperature?
Absolutely. Nigeria is not new to administration and management of vaccines routinely. We have a very robust routine immunization program, and in fact have very recent successful experience of introducing new vaccines. The human papilloma virus vaccine was just introduced from the end of last year to about the mid of this year across the country. And we have the infrastructure in place. We have a national strategic cold store, which in fact is where the consignment was received. From there, it's going to go to zonal cold stores using temperature remote monitored vehicles that will transport the vaccines, and we monitor remotely the temperature to make sure there is no excursion outside of the recommended range. When they get to the 2 states as well, there are state cold stores where they will stay, and then there are mobile devices inside which they will be moved from one point to the other. So we have a very robust system for managing cold chain for vaccines, and we actually do use remote temperature monitoring devices to track, so that when there is a risk of excursion, we are able to intervene very quickly.
So what we have now is about 800,000 doses out of 1 million for the first batch, courtesy of Gavi, UNICEF and WHO. How soon are we getting the rest, and do we expect some more batches before the end of the year? Some have said that for full coverage and to secure herd immunity, Nigeria will have to start budgeting for its own vaccines.
I think it's very important to say that the vaccine is a relatively scarce commodity at this point. Nigeria is fortunate to be one of the countries getting access. So when you don't have enough, depending when we have enough, we decided to prioritize Kebbi State and Bayelsa State. This due to the disease burdens, in both of those places, like you have said. We hope to learn from that. When it's also an expensive vaccine, so we want to make sure we deploy it in the most cost-effective way possible. So we will learn from that while working with our partners to plan a scale-up to the rest of the country. So the specific timing for that, we do have a tentative plan, but the idea is that's subject to our credibility globally, but also to the lessons that we learn in terms of how best to deploy this to maximize the acceptability to the people and make sure that we get the maximum value out of it.
It's a good place to leave it. We'll continue this conversation subsequently. Moyo Aina is Executive Director, National Primary Healthcare Development Agency. Thank you for talking to us tonight.
Thank you very much.